welcome to your assessment. Now today I have a special piece of equipment to show you. We have the keratometer. This piece of equipment which is used for checking the curvature of the cornea. So the cornea is the window of the eye there, and from the side the cornea is the transparent window to the eye. A very sophisticated optical refracting surface. This is the cornea, and the cornea is also located on the picture there. So, how does the wonderful keratometer work? Well, as you can see, first of all we have a focusing wheel there to obtain the optimal focus of the images when looking through the viewing portal. And we have a magnification window here for viewing the scale. As you can see, looking through, we have a magnified view of the scale. And here we have a device which can bring the images closer or further apart when taking the measurements. And when the images are touching, we can read off the small scale just there. It's slightly hidden, but there's a small scale for checking the curvature of the cornea. And this allows us to check the curvature at 90 degrees to one another to determine if there's any corneal astigmatism. We can check for corneal astigmatism. Okay, and we also have the axis scale on the outside here and an inner scale. So when we check the curvature of the cornea, we can check the axes too. So that's the keratometer. We also have, similar to the slit lamp, a wheel for adjusting the height and a joystick for bringing the machine closer to your eyeball or to take it further back. Okay, so maybe we should take some corneal measurements from your eyes. Okay, so we're in position. So this is keratometry, starting with the right eye. Okay, let's get started. So your job is to look straight into the distance. I'll have a look through the machine here. Just be adjusting the distance, get the optimal focus. Okay, now just blink normally for me. and I will just refine the readings. Excellent. Just fine tuning here. I'll have a look at the scale. Okay, so we're looking at possibly 8.8 millimeters at 120 degrees. So that is the curvature of the cornea. 120. So 90 degrees to that. I'll go to 30. There we go. So 30 degrees to the initial reading. Let's have a look what the curvature is there. And just have a slight discrepancy, so we're not exactly 90 degrees apart. It looks to be .7 millimeters at 35 degrees. Okay. Let's move on to the left eye now. Okay. And we'll obtain the correct distance from you. Excellent. Okay. Keep looking into the distance straight ahead now. So possibly looking at 80 degrees. Okay, 90 degrees, sorry. Just a little bit of fine tuning there. The curvature of the cornea there as the images are touching through the scalp is 8.8 again, similar to the right eye, at 90 degrees. Okay, so going directly 90 degrees to that, we'll hit 180. There we go, and just refine the axis now. Okay, so possibly 175 degrees. Okay, so we're looking at 175 degrees, and the curvature is 8.9 millimeters at 175 degrees. So that is your corneal curvature measured. So now that we have these readings, what use do they have? Well, we can use them to select a contact lens to go into your eye. So before we pop any contact lenses into your eyes, I want to take some further measurements. three things. Vertical palpebral aperture, the right eye. Looking into my left eye, 11 millimeters. Right eye now. Okay, and 11 millimeters again. We're going to use this scale to measure the diameter of the iris. Looking into my left eye again now. Excellent. So we're looking at 12 millimeters right eye. Looking into this eye, we have approximately 12 millimeters again. So iris diameter 12 millimeters, right and left. And you've seen the pupil measuring scale. We'll check the size of the pupils now. Looking into this eye. Good. Looking at the scale, bright light 7 millimeters for the right. This one now. 5, 6, 7. About 7 millimeters again. So 7 millimeter pupil size. Excellent. And we'll do a quick health check of the eyes with the portable slit lamp. Focused correctly. Okay, looking at my right ear so I can check the health of the eye there. Okay, now looking to the right, to the left, just up to the ceiling and down to the floor. Excellent. So we have a very white conjunctiva, minimal hyperemia, no discharge. You're not experiencing any discomfort in the right eye. Excellent. Okay, looking at my left ear. If you don't see the ear, just look straight ahead. There we go. To the right, to the left, up to the ceiling, down to the floor, just sweep across the eyes. Okay, excellent. Okay. Right, just looking down to the floor now. I'm going to sweep across the eye, looking at the lids and the lashes. External look here, external look. The other eye now. Okay. Looking good. Okay, so we need to select an appropriate contact lens based on the measurements here. I'm just going to have a look in the lens bank. And we may need a contact lens case for you. Okay, so we have plenty of contact lens cases in stock for you. Obviously need some solution to store them in if we go ahead. contact lens labelled up, right lens and left lens. These obviously have to be changed every few months. These are plastic. You have a little space there to store your contact lens and pop your solution in. And we have the left pot. And there we go, hollow space for the contact lens and solution once those are in. Seal it tightly, and there you have your small and discreet contact lens case. Okay, back to your contact lenses. I have selected a reusable lens for you. And selection of lenses there in their solution. Going to wash my hands here. Okay, so shall we insert a contact lens in your right eye? I'll just remove it and pop it in for you. It's not going to hurt. Will feel a little bit strange. But after it's settled for an ample amount of time, we should have a well-fitting contact lens. Okay, so just looking up to the ceiling, lower the lid and place the lens in the eye there. Excellent, excellent. So just take a blink for me and we'll allow the lens to settle. Okay, next lens for the left eye. And looking up, okay, looking down now, place the lens in the eye. Good, excellent. So look around, take a few blinks, allow the lens to settle. Just take some notes of the type of lens we're using. Reusable, soft contact lens. Okay, so we have a diameter 14.2 millimeters and a base curve of 8.7 mil. Power +1 and left is +1 dioptosphere lens. Dioptosphere. So how do the lenses feel in your eyes? Okay, and what would you score the comfort out of 10 for each lens? So right, 9 out of 10, that's a good start, and the left 8 out of 10, so the left just slightly more aware of the lens. Okay, Okay, let's check the lenses in your eyes. An external look here, full corneal coverage. Good. Let's just have a look at the fit of the lens now. Okay, looking at my right here again. Okay. Blink. Now looking up. Blink while looking up. Good. Look to the right. Look to the left. Push the lid up here, we'll do a push-up test. Okay, well-centered lens, minimal decentration, good movement on blink and good recovery and easy to move with a push-up test. Okay, looking into the distance, I'll check the left one here. Blink, looking up, blink again, okay, looking right and looking left. Okay, we'll do a push-up test here. Good. Okay. So slight contact lens decentration nasally, but still full corneal coverage. Up gaze blink 0.4 approximately. Good. Push up 60%. Smooth, fast recovery. Excellent. Okay, so let's see if we can obtain a look with the blue light now. Okay, looking straight ahead now, just straight. Okay, this just enhances my view a little bit better. Okay, and to the left eye now. Keep looking straight, doing a fantastic job. And we'll have a look with the green light. So back to the right eye here. And I just want to check the blood vessels. Good. To the left eye now. Start from temporal side. And to the nasal side. Good, good. Looking up now. Okay, so we seem to have a healthy eye with the contact lens in place. Your eye is obviously happy to have the contact lenses in. Good. Okay, just cover your left eye for me. How many fingers am I holding up there? Now, good. Cover the other eye for me now. 3, 2, 4, and 1. Good. So, I'm going to take some notes here. So the contact lens fit. 6.5 push-up, 60%. Decentration, right minimal, left 0.1 nasally. Hyperemia is approximately grade 1.2 in each eye. Blood vessels obviously quiet, limbal vessels quiet at grade 1.0 right and left. Blue light assessments, green light assessments, plate, and the vision, right eye, 1 meter. Pass. Okay, so it looks like the contact lenses are looking like a good fit. You're relatively happy with the comfort. So I'm going to leave these lenses in for 20 minutes and I will reassess you when you come back through.